Congratulations on the birth of your new baby. You have spent 9 long months in anticipation of your new bundle of joy, and now you are probably wondering what happens next. The goal of this presentation is to make sure you're comfortable caring for yourself and your baby before you go home. And if for any reason you feel less than confident, we want you to know that you have help, even after you leave the hospital. And at the end of this program is a list of resources to call if you have questions or problems. You'll also receive a printed copy of the list to take home with you. The American Academy of Pediatrics encourages women to breastfeed exclusively until infants are 6 months old and to continue breastfeeding along with other foods for the first year or longer. Whether you choose breastfeeding or formula feeding, your baby should be eating on demand at least 8 to 12 times in a 24-hour period. Cues that mean your baby is hungry and ready to feed include turning the head and opening the mouth wide, sucking on hands, bobbing the head around your breast, and licking or smacking the lips. Skin-to-skin contact with your baby while breastfeeding is highly recommended. Bare skin contact helps not only with breastfeeding, but also in soothing the baby and helping to bond with family members. Breastfeeding is more comfortable and productive when the baby latches on correctly and is held in the right position. Various positions can be used, including the football hold, cross cradle, side lying, and lying back. No matter which position you choose, remember a few basic things. Keep baby's tummy facing your body, and let the baby's arms hug your breast and avoid trapping them to your body. And support your baby's whole body with your arms, body, or pillows, and get comfortable yourself. And bring baby to your breast, not breast to baby. The correct latch is very important and can prevent complications from developing. With a correct latch, your baby will get more milk and you will have no pain. Here are some steps to a correct latch. Tuck the baby's bottom close to your body. Tilt the baby's head back slightly so the chin touches the breast first. Tip your nipple up toward the baby's nose and wait for the baby's mouth to open wide. Then pull the baby in closely. Babies should be burped midway through feeding and at the end of feedings. To burp your baby, place him or her in an upright position and gently pat the baby's back. You may want to use a breast pump if your baby is not nursing well, if you are separated from your baby for several hours at a time, or if you need to restart or increase your milk supply, or to help reduce engorgement, which is mild swelling or fullness in the breast. The hospital has breast pumps available for rent if you do not want to purchase your own. And remember, it's normal to only get small amounts of milk the first few days, but this will increase as your supply increases. To prevent soreness, blisters, or bruised nipples, make sure you have a correct latch. Reposition and relatch if necessary. Sore nipples can be soothed with products such as lanolin creams and hydrogel pads. Then a consistent, correct latch will prevent further damage. You may experience breast engorgement a few days after giving birth. To prevent engorgement, keep your baby with you and nurse as soon as the baby shows early feeding cues. Let the baby finish nursing on one side before switching to the other breast and alternate which breast is offered first. Don't skip feedings or offer bottles of formula. And finally, express milk by hand or use a breast pump if a feeding is missed. If your breast becomes severely engorged, they may become hard, painful, and often red and warm. Even if this happens, keep feeding your baby. It may be harder for your baby to nurse when your breasts are engorged, so try hand expressing or pumping a small amount of milk before latching the baby, and massage your breast before and during feedings. To reduce discomfort and swelling, apply cold packs between feedings for 20-minute intervals and take doctor-approved medications for pain. If the engorgement does not improve within 24 hours, please call your healthcare provider. Mastitis is an inflammation of the breast that can happen when bacteria enter the breast through a cracked or sore nipple. Symptoms of mastitis include pain, swelling, redness or warmth in the breast area, red streaks extending from the breast, pus draining from the breast, swollen lymph nodes in your neck or armpit, and flu-like symptoms, especially a fever. If you experience any of these symptoms, call your physician. Mastitis is a very serious condition, but it is easily treated with antibiotics, and you can keep breastfeeding even if you have mastitis. The infection is in the breast tissue, not the milk, and will not cross to the baby. Nursing will help prevent further engorgement. Start formula feedings by washing your hands and using clean, boiled bottles and nipples. Follow the manufacturer's instructions and guidelines to prepare the formula. Formula-fed infants may go longer between feedings because formula takes longer than breast milk to digest. Even when using formula though, you will feed the baby on demand and watch for signs of hunger rather than the clock. If you prepare bottles of formula ahead of time, be sure to use them within 2 hours or put them in the refrigerator. Use refrigerated bottles within 24 hours. And always throw away any formula left in the bottle after each feeding. And don't put the bottle back in the refrigerator or feed your baby leftover formula. To warm up formula that has been refrigerated, put the bottle under warm tap water or in a bowl of hot water, or use a bottle warmer for no longer than 15 minutes. Do not heat formula in a microwave or on the stove in a hot pan of water. And always shake the bottle and test a few drops of warmed formula on your skin before giving it to your baby. Babies should be burped midway through every feeding and at the end of feedings. To burp your baby, place him or her in an upright position and gently pat the baby's back.
New moms often wonder, is my baby getting enough to eat, and how can I know? To know that your baby is feeding well, watch for signs such as relaxed fingers and arms, swallowing sounds, visible milk in the mouth, and cues that he or she is getting full, such as drowsiness, sleeping, letting go of the breast. Having 6 or more soaking wet diapers per day after 7 days old is another sign the baby is getting enough to eat. Please seek the advice of your physician or lactation consultant if you have any concerns. A loss of up to 10% of the birth weight is considered normal, and most babies will gain back up to their birth weight within 2 weeks. Your baby will be weighed at each well baby visit to check for weight loss. Typical newborns gain about 6 to 8 ounces a week for the first few months, and then about 1 to 2 pounds a month. Always clean all stool off your baby's diaper area during changes. For girls, always wipe from front to back when changing her diaper. For boys, if your baby is circumcised, put a dollop of petroleum jelly on the penis or in the front of the diaper with every diaper change for 7 to 10 days until it's completely healed. Do not tub bathe until the penis is completely healed. If your baby boy has a plastibell, do not use petroleum jelly. And notify your baby's pediatrician if it has not fallen off after 8 days. If you notice signs of infection, such as redness, swelling, a foul smell, or pus, please call your baby's pediatrician. If your baby is not circumcised, do not try to force the foreskin back. Your baby's first stool is called meconium. It's generally black and very sticky. Breastfed baby's stool will soon change to a yellow, loose, seedy appearance. Formula-fed babies will have tan or brownish stools that are firmer in texture. Make sure to change your baby's diaper often. A good time to check the diaper is right after the baby eats. You will know that your baby has urinated when the yellow stripe on the diaper has changed to a bluish green. Sometimes, no matter how often you change the baby's diaper, a rash develops. When this happens, wash your baby's bottom with warm water and apply a diaper rash cream or petroleum jelly. Diaper rash ointments may be used if the diaper area becomes reddened. Allow the skin to be open to the air as long as possible. And see your pediatrician about persistent problems. You do not have to do anything special to care for the cord stump. Keep it clean and dry, and fold the top edge of the diaper under so that it doesn't rub against the stump. The cord stump will fall off on its own, usually in 7 to 10 days. The belly button may bleed a little bit or look a little raw for a couple of days, and this is normal. If you notice signs of infection, such as redness, swelling, a foul smell, or pus, please call your baby's pediatrician. Your newborn only needs a full tub bath a few times a week. Wait until the cord stump falls off before giving a tub bath. Don't use soap on the baby's face. Just use warm water on a clean washcloth. For the rest of the body and hair, use baby wash and clean from top to bottom or from clean to dirty. Wash the upper body first and the diaper area last. Look in your postpartum and newborn nursery patient care guide for a list of bath safety tips. If your baby's skin or the whites of the eyes begin to look yellow, call your baby's pediatrician, especially if the baby is lethargic and feeding poorly or less often. Sudden infant death syndrome, also known as SIDS, is the unexpected death of a baby younger than the age of 1 year without a known cause. To help prevent SIDS, make sure that your infant sleeps on his or her back. Put your infant on a firm surface or mattress. Never put your baby on a couch, sofa, pillow, or blankets. Do not sleep with your infant. Room sharing can help prevent SIDS as long as you remember to put your baby back in his or her own bed after calming or breastfeeding. Do not smoke around your baby. If you do smoke, do it outside and change your shirt and rinse your mouth before handling the baby. Don't allow your baby to get overheated. To be comfortably warm and not too hot, babies generally need only about 1 more layer of clothing than you do. Avoid the use of blankets. Instead, use a sleep sack at nap time and bedtime. You should avoid using a swing, carrier, or car seat as a bed. When driving with your child, have someone sit in the back seat with the infant to observe them whenever possible. Once you get to your destination, if your child is asleep, take them completely out of the car seat and put them on a firm surface or mattress. In summary, here are several ways that moms can strengthen their infant's odds against SIDS. Never smoke around the baby. Breastfeed your baby. Breastfeeding has many benefits for both mom and baby. Do not rely on products claiming to reduce the risk of SIDS. Most have not been tested. Wait until your baby is well established with breastfeeding before offering a pacifier, usually around the 3rd or 4th week. If you do use a pacifier, choose one with no attached strings. Keep your house between 65 and 70 degrees. Remember, your infant only needs to be dressed in 1 more layer than you. If you have an older baby bed, make sure that it meets modern standards and is safe to use. If a soda can will fit between the rails, it's not safe. Put your infant's stuffed animals, pretty bumpers, and blankets in the old bed, but not your baby. When you put your baby to bed, start her out on her back on a firm surface. If your baby rolls over during sleep, you don't need to reposition her again. All babies cry. This is how they communicate, and it's totally normal. However, it can be very hard on parents. They don't want their little ones to suffer in any way. Your job as the parent is to try and figure out what they need. They might be hungry or in need of a diaper change. In time, you will learn what your baby's different cries mean. Your baby might be overstimulated. She might be too cold or too hot. He might have gas or need to burp. Or your baby just might want to be held. Don't think that holding your baby frequently will spoil him. Enjoy this time with your baby. This bonding time is precious. However, sometimes too much baby can be overwhelming to anyone. If you feel like you are losing control, put your baby in a crib. Call a friend or relative to come and stay for an hour or two. Whatever you do, do not shake your baby. Everyone needs a break sometimes. Don't be hard on yourself for feeling this way. It's okay to give yourself a timeout. When you're rested, you'll be able to give your baby better care. After you've covered all the basics, the baby's dry, fed, and warm, but the crying continues, don't give up. Try rocking or bouncing the baby. You can sing or play a soothing song, massage your baby, or give her a relaxing bath. Sometimes just a change of scenery will do the trick. You should call your pediatrician if your infant shows any of the following signs. Temperature taken under the arm is 100.4 or higher. No wet diaper within 24 hours. The baby's behavior changes. Excessive crying. Missing 2 feedings in a row. The baby has diarrhea or vomiting. Your baby's breathing is faster than normal. The baby's skin appears more yellow or suntanned. As the parent, you know your baby better than anyone else. Trust your instinct. If you think something is wrong, please call your baby's pediatrician.
You will need a car seat to take your baby home in. Indiana state law requires that all children must be in a car seat or a booster seat till their 8th birthday. Franciscan Health offers free car seat inspections by appointment only for anyone who is going to take care of your baby, including grandparents, sitters, and nannies. A certified technician does these inspections for you. Please keep in mind that your nurse is not a certified technician and will not be able to help you with the car seat installation. Your baby is the most precious cargo you will carry, so make sure that you do the following. Read the owner's manual for your car, which will tell you where to place your child's car seat. Never put your rear-facing car seat in front of an active airbag. Read the car seat manual as well. This manual will show you how to secure the car seat in the car, using the latch system or the seat belts. Never use both. In this case, more is not better. The manual will tell you the minimum height and weight restrictions for that particular car seat. Newest recommendations say that infants should sit facing the rear of the car until at least the age of 2 or until the maximum age given by the car seat manufacturer, whichever is longer. Do not use any aftermarket products with your car seat. No car seat manufacturers support the use of these products. The features and accessories that come with your car seat have been tested and are okay to use. You may bundle your infant in blankets if necessary. This does not affect the car seat harness and is allowed for use. Just make sure your baby is not overbundled. During the winter, never use heavy coats or snowsuits in the car seat. Don't use anything thicker than a hooded sweatshirt. Thick coats may push your child too far forward, which could cause them to fly out of the car seat in case of an accident. Car seats do expire. The manual that comes with the seat will tell you how long it can safely be used. Make sure you know the history of the car seat you are using if it is not new. Don't buy a car seat at a garage sale or from someone you don't know. You can't always tell by looking if the seat has been in an accident and may not provide the protection your baby needs. Make sure you send in your car seat registration card. Registration allows the company to contact you in case of a recall. As a matter of fact, that goes for all baby products. A great resource is this website sponsored by American Academy of Pediatrics, www.healthychildren.org. This site provides a guide that includes all stages of car seats, links to seat recalls, and the newest recommendations for car seat use. Your baby's pediatrician should tell you when to make the baby's first appointment for a well baby checkup. This appointment is typically done within the first 2 weeks of life. However, if your baby has issues such as excessive weight loss or jaundice, your baby's pediatrician may tell you to make an appointment within a couple of days of discharge. For help when you are home, refer to the back cover of the Postpartum and Newborn Nursery Patient Care Guide for a detailed list of reasons to call your baby's pediatrician. Some reasons include an underarm temperature of 100.4 degrees or higher, eating poorly or refusing to eat, repeated vomiting, not having a bowel movement for over 48 hours, less than 6 wet diapers a day, or if your baby is difficult to wake up. Call 911 if your baby is struggling to breathe or is turning blue. Use your peri bottle in warm water to perform pericare 3 to 4 times a day for the first week after leaving the hospital. Pericare needs to be done by patients who deliver vaginally as well as patients whose babies were born by C-section. Gently pat the area dry with toilet tissue. You must perform pericare after every bowel movement that first week after delivery. Always remember to wipe your perineal area front to back in order to help reduce the risk of infection. Avoid tampons, douching, intercourse, swimming pools, and hot tubs until after your 4 to 6 week follow-up appointment with your physician. Those are things that can increase your risk of developing an intrauterine infection. The vaginal bleeding you experience after giving birth is known as lochia. Lochia starts out as a red discharge, progresses to brown, and then finally fades to a white discharge. Your bleeding can last anywhere from 2 to 6 weeks. If you are breastfeeding, you will notice an increase in the amount of bleeding when you are nursing your infant. Your uterus contracts during breastfeeding, which pushes out more of the vaginal bleeding or discharge. The amount of bleeding after delivery is about the same as a heavy period, which will decrease a little each day. If you have signs of unusually heavy bleeding, you should call your physician immediately. These signs include passing a clot as big as a 50-cent piece, soaking a small peri-pad in an hour, or passing clots or seeing clots in your peri-pad every time you go to the bathroom. A cesarean delivery is major abdominal surgery. It is very important that you take time to care for yourself once you go home. Drinking plenty of water, eating high-fiber foods, and doing activities such as light walking can help reduce constipation. Avoid tub baths until your incision is completely healed. It is fine to take a shower, but avoid loofahs, which can harbor bacteria. Just use a clean washcloth on or around your incision area. It's important to make sure your incision is dry after your shower. Use a towel to gently pat the area and remove moisture. Leave your incision open to air when possible to promote the healing process. The first few weeks after delivery, look at your incision with a handheld mirror 3 to 4 times per day. Call your physician if you notice redness around the incision, a foul-smelling odor or drainage coming from the incision, or any area that appears to be separating or coming apart. You will want to also notify your physician if you have a bloated abdomen, difficulty urinating, or any cloudy or foul-smelling urine. Notify your physician if you have nausea, vomiting, pain or redness, tenderness or swelling in your legs or calves. If your incision was closed with Dermabond or skin glue, the glue will dissolve once the incision has healed. If your incision was closed with staples, they will need to be removed in your physician's office about 1 week after delivery. Your physician will have you call the office to schedule an appointment to have the staples removed. It may take a while for your systems to get back to normal function. Medications, hormones, dehydration, and the general trauma of labor and delivery can cause your bladder and bowels to be out of sorts. If you don't have a bowel movement within 5 days after delivery, try walking more and increasing your light activities, drinking more water, eating fiber-rich foods, and taking a stool softener. If these things don't help, notify your physician. Your bladder may be temperamental for a few days after you deliver. You may experience some minor leaking of urine, or you may find it difficult to empty your bladder. During this time, it is recommended that you attempt to empty your bladder at least every 3 to 4 hours. You may also feel that you need to use the restroom often as your body rids itself of extra fluids that cause leg swelling in late pregnancy, as well as IV fluids you may have received during your hospitalization. If you were diagnosed with high blood pressure or preeclampsia during your pregnancy or postpartum, you should notify your physician of any signs that your blood pressure is not improving or that it is worsening. If you were put on blood pressure medication during your pregnancy or postpartum, your physician may continue the medication for a few weeks after you go home. Your physician may also instruct you to come by his or her office to have your blood pressure checked within the next few weeks. You will need to call your physician if you experience nausea, vomiting, pain up under your right breast, or stomach pain, a headache that does not go away with pain medication, or blurred vision or seeing spots. Although increased blood pressure and preeclampsia normally resolve when the baby is delivered, it is possible that your condition may worsen. Call your physician if you experience any of these signs of a possible uterine infection. Discharge that has a foul odor. Normal discharge will have a smell that is like blood or fleshy, but if it starts to smell really bad, this may be an early sign of infection. Abdominal pain that does not go away after taking pain medication. A fever greater than 100.4 degrees Fahrenheit that lasts longer than 24 hours. Call your physician immediately if any of these happen. Your uterus starts out about the size of your fist prior to pregnancy. After you deliver, it's about the size of a grapefruit. During the first few weeks after birth, you may feel afterbirth pains, cramps, or contractions, especially during breastfeeding. While somewhat painful, these contractions help reduce uterine bleeding and help to shrink the uterus back to pre-pregnancy size. Some moms have periods of tearfulness before delivery and even afterward. This can be normal. It is related to all the hormones associated with the pregnancy. Postpartum blues, also known as baby blues, is a common condition that occurs in 50 to 80% of all postpartum women. The onset can occur within the first few days after you deliver. It can last up to 2 weeks postpartum. Symptoms of postpartum blues usually come and go quickly and include feelings of impatience, irritability, or crying. These symptoms usually go away on their own after a couple of weeks. If they last longer than 2 weeks, become severe, or interfere with your daily activities, contact your healthcare provider immediately. Postpartum depression is different from baby blues. Symptoms of postpartum depression can start as early as the 2nd or 3rd day after delivery, but it may take several weeks or even months for the symptoms to develop. It shares many of the symptoms of baby blues, but they are much more intense. Other symptoms that can occur with postpartum depression include loss of appetite, crying spells, feelings of hopelessness or loss of control, fear of touching the baby, little concern about your appearance, inability to sleep or excessive sleep. You may also have feelings of wanting to hurt yourself or your baby. If you think you are having symptoms of postpartum depression, it is very important that you call your physician and seek medical help immediately. Don't exercise your abdominal muscles and don't lift anything heavier than the weight of your infant until you see the physician at your postpartum checkup. No vigorous exercise is recommended until after you see your physician at 4 to 6 weeks postpartum for your checkup. Walking and Kegel exercises are generally safe for postpartum women.
While you are taking a narcotic pain medication, it's advisable to take a stool softener as well, since these pain medications can cause constipation. Remember to ask your physician or nurse about taking a stool softener. Most narcotic pain medications also contain Tylenol, so they should not be taken together with Tylenol. Excessive doses of Tylenol can lead to liver damage or liver failure. Call your physician's office upon your release from the hospital to schedule your postpartum visit. This appointment is usually set for 4 to 6 weeks after delivery. We hope you enjoyed this presentation. We thank you for choosing Franciscan Health and allowing us to participate in this wonderful time for you and your family. Remember, take good care of yourself so that you'll be able to take good care of your infant. Accept help from other people around you so that you can take breaks, eat well, and sleep when the baby sleeps. But most importantly, know when and who to reach out to for help when you need it. Some resources to keep in mind is the outpatient lab, the birth recorder's office, the WIC program, and social services. You can also contact the postpartum charge nurse at any time and ask for advice. Our lactation specialist can help with breastfeeding advice and support. Call them to set up a free appointment or to learn when and where group support meetings take place. There are postpartum depression support groups, a behavioral health crisis line, and car seat safety inspection services available for you as well. Be sure to use your resources. We are here to help. Again, from all of us at Franciscan Health, congratulations and good luck with your new little one.